Good afternoon, everybody, and a huge welcome to this, our second last webinar in the Thriving After Massive Global Disruption series. And I'm Phil Considine from the University of Strathclyde. I'm Director of Policy at Strathclyde, and I'm absolutely delighted today to be welcoming the City University of New York, who will be leading on today's webinar. The City University of New York is an institution that has a list of alumni and staff that is second to none. Alumni include Henry Kissinger, Mario Puzo, Andy Gore of Intel fame, and for those of us that enjoy comedy television, Jerry Seinfeld. Even the people who, even the dropouts from City University of New York seem to do particularly well. Jennifer Lopez and Ralph Lauren featuring amongst people who dropped out, so that's not a bad list of your dropouts. And staff-wise, again, Abraham Maslow, Stanley Milgram, Philip Zimbardo, Elie Wiesel, a list that is just quite stunning. So today, I'll be handing over in a minute to Ryan Ulian, and Ryan will be doing the welcome on behalf of CUNY. Ryan is the director of the Advanced Science Research Centre and is an Einstein Professor of Chemistry at Hunter College. Today, what we're going to be looking at today, though, is the urban public university as an engine of recovery. One of the things that I think we've all realised, and certainly in the UK this has been brought painfully home, is how the crisis impacts marginalised poor people in the United Kingdom, the impact it's had on our Black minority ethnic community has been absolutely horrendous. And one of the things that City University of New York prides itself in is its inclusivity, its diversity, and the way that it engages. And today the panel will discuss three interconnected areas that COVID has had a significant impact around public health, the environment, and public education, and how in a diverse and dense urban environment like New York, the solutions that we need cannot be delivered in silos, but instead have to take a systems-wide approach. We have Ryan will do the introduction, and we then have three presentations today from Louisa Burrell, and Louisa is Distinguished Professor in the Department of Epidemiology and Biostatistics. We have Charles Voris-Marti, and Charles is the Director of the ASRC Environmental Science Initiative and Einstein Professor of Civil Engineering. And we have Nina Gray, and Nina is Executive Director of ASRC and Associate Dean of Sciences. So what I would like to do is to pass over to Ryan, who has got really strong connections to Strathclyde as a former member of our team. And Ryan will do a welcome on behalf of City University of New York.
Thank you very much, Phil, for that introduction. Let me see if I can share my screen. So thank you, Phil. So we're delighted to be part of this really exceptional series. It's been a breakfast treat for us every Tuesday for the past couple of months now. So my name is Ryan Ulian. I'm a proud Strathclyde alumnus. I did my PhD in physical chemistry there, and some years ago I returned there to be a professor of chemistry, and after that, about 6 years ago now, I moved to a new position here at the City University of New York. But the ties remain strong, and the two universities actually have quite a lot in common, in that they both serve large and diverse urban populations. They're both innovative and very agile, and they focus on strong integration of what the university does, of everything what the university does with society and the local environment. So this, I guess we've looked at many times now. I think I'm not alone in having experienced a change in perception of both space and time during this period, with some weeks flying past, other ones just dragging on, and mostly staying in a few mile radius of my home, while normally I would be traveling the world attending conferences. So for those of you who've dialed into this series before, in the very first one, we had Professor Jeremy Lauer from Strathclyde, who spoke about exponential time, where time seems to have accelerated but also slowed down. And the same seems to happen with space, where the world seems to be getting a bigger and smaller place at the same time. And to me, it's intriguing. So I'm a nanoscientist, and it's intriguing that a 100 nanometer nanoparticle can have such a profound impact across 14 orders of magnitude on what happens to the globe. And of course, these are complex relationships. Everything is connected. And what we're talking about today really is how urban environments, in particular densely populated urban centers like New York City, can catalyze and amplify these effects. So as you all know, New York City was particularly hard hit by the COVID-19 crisis, and subsequently also became a national focal point for racial inequality issues through the Black Lives Matter protests. So these crises are clearly closely connected to other issues, including environmental inequities that exist in urban environments. So these complex, multi-scale, short-term, long-term, local, global, these are precisely the types of issues that we like to study at the Advanced Science Research Center, where three of the four speakers today work. As you will see during our discussion, our urban university, CUNY, has been particularly impacted by COVID and also by the racial inequity issues. And today we will share with you some thoughts on the current state of affairs with some really eye-opening statistics. And also we would like to end on a positive note. The series is called Thriving After Global Disruption After All. So you'd like to look at how we can turn this crisis into opportunities through embracing STEM education and interdisciplinary science for all people. So for those of you who are not familiar with CUNY, it is a truly remarkable university. And Phil made some comments about some of our alumni. It is a place. There's no other place like it. It's the largest and most diverse public urban university in the U.S., probably on the planet. It's New York City's education machine, where 80% of students who come through the CUNY system end up working in the city. So it really provides the workforce for the city. So very famous universities like Columbia University, Ivy League, is also in New York City, but serves a very different role. So the role of powering the city is also, I think, something that we have in common with a place like Strathclyde. So we have 500,000 students collectively. So that's part-time and full-time students through all 5 boroughs of New York City. And the campuses alone, we have 25 of these campuses, and they typically have tens of thousands of students. So they could be viewed as like universities in their own right, but they're all connected through this common CUNY umbrella. And I'm just going to name a few of the names of these colleges because I will come back later in the talk, and I want to make sure that people follow what we're talking about. So CUNY is composed of these 25, and these individual universities and colleges have names like Brooklyn College, Queens College, Hunter, Baruch, City College, and others. So these names will come back later on. So these are all part of the CUNY system. We take great pride in that we are by far #1 in the US for socioeconomic upward mobility. So what that means is taking students from the bottom socioeconomic quartile into the top socioeconomic quartile through education. That's something that CUNY has done incredibly well. And that's something that we are, through the ASRC, building in STEM, where New York is perhaps not known for its STEM. And this is something that's rapidly changing, and we hope that CUNY can be a catalyst in this. So I'm actually calling you from, this is my second day back. We're at 20% right now from this amazing place that you see on the screen right now. This is the Advanced Science Research Center, and it took a lot to get me away from Strathclyde, but I could not resist this opportunity to come to New York and help set up this fantastic research center. So for those of you familiar with the city, I don't know if you can see my cursor, but this is the Midtown skyline. You can see the Empire State Building. This is Central Park here. So we're north, we're in Harlem, and we're looking down, we're in Manhattan looking down into the city. And this is the Advanced Science Research Center. Within that, we have 20 internationally recognized research labs in 5 focus areas. And as I said at the very start of my introduction, we're interested in matters of scale and time and complexity and how things connect together. So all these labs actually have completely different research focus. So we have chemists, engineers, biologists, physicists, working together in areas like photonics, nanoscience, environmental science, structural biology, neuroscience, and really see how we can make connections. So the whole building really is an experiment in its own right, and it's an amazing place. So I know we have a global audience now, so if you ever stop by New York when that's allowed again, please come and see us. We enjoy collaborating and learning from others. We have 15 high-end core facilities. These are a resource for science for thousands of users. I believe Nina will talk a little bit more about this. And we do a lot with academic industry partnerships. Again, science for the good. Strathclyde talks about the place for useful learning. It's that kind of ethos where we try to make sure that our students are ready to contribute to society. And again, Nina will talk a little bit more about that. So today's panelists, it really is a great pleasure, and I'm very grateful that my friends and esteemed colleagues here found time to help out, because I was the one who said, yes, we'll do this, and I'm very grateful that they could make time available. Three really spectacular colleagues. Louisa Burrell will speak about New York City at the heart of the current connected crises, and specifically how CUNY fits in with that. Then Charlie will talk about connected crises require connected solutions, and the way of thinking that is required to help solve these issues. And then finally, Nina will end on a positive note in how public higher education like CUNY, like Strathclyde, like many others can potentially be an engine of recovery if deployed appropriately. And now is the time to start planning these things. So with that, I'd like to introduce Louisa Burrell. She's a distinguished professor at the Department of Epidemiology and Biostatistics at the Graduate School of Public Health and Health Policy here at CUNY. Her research interests are highly appropriate for today's conversation. She's interested in race and ethnicity, socioeconomic position, and neighborhood effects as social determinants of health. So Louisa, I'm going to hand over to you. I will stop sharing my screen, and I look forward to your contribution.
Thank you. So good morning, can you hear me okay? Good morning, afternoon, or evening, and thank you for having me. As Ryan said, I am a distinguished professor at the CUNY Graduate School of Public Health and Health Policy, and I am delighted to be here. So health inequities in the US are common, and they are more commonly observed across racial, ethnic line, and socioeconomic position. These health inequities have been pervasive over time and are rooted in a combination of individual and structural factors where access or lack of to resources and opportunity play a major role. First, this inequity were documented by race, mostly between blacks and white, and as recently as 1980 with the inclusion of Hispanic as the sole US ethnic group across all racial ethnic groups. For infant mortality, black and white inequity dated back to the early 1900s. It is worth noting here that although we have made progress over the past 100 years, this gap still remains regardless of how we examine this inequity, whether it's with a relative or absolute measure. Babies of African American or Black women are more than twice more likely to die than babies of white women. When it comes to adult mortality, African American and American Indian or Alaska Native are more than 10% more likely to die than whites. And Hispanic and Asian are actually 40%, at least 40% less likely to die than whites. Here, I would like to make an important point with relationship to Hispanic and Black. These two groups share the so-called minority status. However, despite the low socioeconomic status and low access to healthcare due to lower health insurance coverage of Hispanic, they fare much better than African American and in fact than whites. This is not unique to adult mortality. This advantage can be seen for a wide range of health outcome, including infant mortality, and it had been coined the Hispanic paradox. When the first cases of the COVID-19 virus surged in the US, the virus was seen as the equalizer, meaning that it wasn't going to discriminate by age, sex, gender, race and ethnicity, skin color, wealth, fame, income, you name it. However, this assumption was naive and ignored completely the existing inequity in the US across race and ethnicity and socioeconomic positions, and how those factors actually could make people vulnerable to be infected with the virus. As we all know, there are approximately 11.6 million cases and 540,000 deaths worldwide. The US share approximately 30% of the cases and deaths. And while we don't have data for all cases in the US on race and ethnicity and socioeconomic status, we already see that there are clear racial, ethnic, and socioeconomic inequities across cases, hospitalization, and death, with Black and Hispanic and individuals of low income being the one carrying the greater toll of the disease. New York State is not an exception to this. In fact, as Ryan said, New York City and New York State were the epicenter of the epidemics. New York State shared 20% of the cases and death, with New York City carrying 50% of the cases and 85% of the death in the states. New York City is a very unique place in the context of the urban setting and the racial, ethnic, and socioeconomic diversity, which can be an advantage, but for this particular situation, put us in a disadvantage. As we have seen, most of the cases in New York City have been for Blacks, Hispanic, and individual or low income. And interestingly, this has not been distributed across all boroughs equally. The Bronx and Queens, the boroughs with the higher proportion of minority, have shared the higher toll of the death and cases. In fact, when we look at the distribution of minorities, specifically African American and Blacks, we comprise 55% of the population in New York City. We can see that as the proportion of minority increase, so increase the proportion or number of cases in the city. This can also be seen across service workers, where these two groups are overrepresented in the city, and we see the same spatial match of these two maps when it comes to the distribution across the city. Together with racial ethnic inequity, the US is among the top 10 developed countries with the highest income inequality. As expected, this inequality interact and compound with race and ethnicity. As we can see here, for instance, when it comes to wealth, an indicator of personal financial control and stability, for every dollar a white adults has saved in the US, an African American has saved 8 cents and a Hispanic have 11 cents. When it comes to income, there is a gap of 25,000 between blacks and white. And this translate basically that per every dollar a white person make, an African American make 59 cents. And this disparity gets even wider when sex or gender is accounted for. New York City is not an exception to this inequality, and in fact, occupy the second place in the country when it comes to inequities. As can be seen here, the top 1% of the population in New York City make more than 113 times what the bottom 99% make. But there come CUNY. So mirroring the state distribution of the University of California and our very own state University of New York, the two largest public educational system in the country, CUNY 25 campuses are located across the city, across the 5 boroughs. And as you can see here, some of the names that Ryan mentioned: Lehman is in the Bronx, Hunter is in Manhattan, Brooklyn is in Brooklyn, LaGuardia is in Queens, and Staten Island is in Richmond or Staten Island. Our campus locations capture the racial ethnic diversity of the city, especially when it comes to Blacks and Hispanic population. And it can be seen here, the dark spot where are the concentration of Blacks and Hispanic in the city, and the red dot, which represent the CUNY campuses. So it can be a clear distribution across the line of the racial ethnic diversity of the city. But the contribution that is more remarkable for CUNY is that the actual racial ethnic breakdown of CUNY enrollment when it comes to minorities is higher than the distribution of the city, particularly for Hispanic and Blacks. This makes CUNY a particular contributor to access to opportunity and economic mobility through education for minority population, especially for these two groups. And this mobility could contribute to close racial ethnic gaps on health beyond COVID-19 and hopefully promote equity for all over years to come. And I will leave it here. Thank you very much.
Thank you very much for that, Louisa. That was an insightful and it really puts into focus the problems that we have. And although we might like to think that as a society we are changing for the better, there's still a huge and significant way to go, and we still have massive inequality. And we see the impact of inequality not just in COVID, but but we
Yeah.
see it across the globe, and we have seen it over the last, it's been brought into sharp contrast in the last few months, but I think clearly it's an issue that we should have been focusing in on significantly longer. So many thanks for that. For people that have questions, we're getting one or two through via different media. Can I just ask that people with questions use the chat, don't use the chat, use the Q&A function for asking any questions that you have, and we'll pick up on them from there. I've got a couple that have come through on other medium, and we will incorporate them in. We will deal with questions at the end, and so what we're going to do now is we're going to move on to our next presentation, which is from Charles Voris-Marty, who is the director of the ASRC Environmental Science Initiative and also the Einstein Professor of Civil Engineering at CUNY. So if I can pass over to Charlie to go on with the next presentation.
Thank you very much. Can you hear me? Thank you very much, Phil. So let me share my screen. And what I'll be talking about today is the environment, sustainable development, and the 21st century city. And I should mention at the outset that each of these three topics could easily occupy the content of a semester-long course, and their interconnections probably an additional 2 semesters. So at this point, in the next few minutes, I can only scratch the surface, but hopefully I'll give you some of the major features of the issues that are inherent in these very broad topics. Before going much further, I'd like to provide a little bit of perspective. And what I've done here is I've created a timeline from year 1500 to the year 2050. And I've indicated where COVID-19 is on that timeline. So this is the emergency of the day, or of the last few months, let's say. And I wanted to point out that, yes, this is an important disruption. Yes, it's an important public health and economic disruption. But in some sense, it's not alone. And if we go backward in time, we'll see all manner of additional pandemics and epidemics which very strongly affected particular cities. And the point I'd like to make is that these pandemics and these urban health problems do create significant disruptions. At the very beginning of the timeline, we see something that's quite unique. And that's what we call the New World colonization plagues. And although COVID-19 might now be into its sixth month, and perhaps we'll see it for the next year or two ultimately, it's important to understand that there were, at the beginning of this timeline, a set of plagues, called plagues, that lasted literally 100 years and had enormous impacts on the affected populations, with more than 90% extirpation of indigenous populations as the Europeans migrated with their unique set of diseases. I also would like to point out that in the context of all this, and you know, cities get hit hard by these health emergencies, but nonetheless, we can plot the inexorable rise of the urban domain, and people, despite the fact that these cities are decimated by these events, people flock back to urban areas. And I haven't even mentioned the impacts of wars, in particular World War I and World War II, which fundamentally destroyed many of Europe's and Asian cities. And what we see here is that we're moving inexorably toward an urban century, and we have more people today living in urban environments than in rural environments. That's a major Earth system change. I'd also like to, if I can get my screen to move forward, I'd also like to point out that these particular events like COVID-19 are really draped over a set of other stressors that are moving the Earth system in a particular direction. And this is known as the Great Acceleration. And I'm showing here a set of panels. And each panel is a time series from year 1750 to year 2010. And you can divide the list of these agents of human change into socioeconomic trends as well as the impacts on the Earth system. And you can look at all sorts of things that are accelerating: the world's population, as well as the urban population, as I just mentioned, real GDP or economic growth, primary energy use, fertilization of our crop systems, water use, paper production, transportation and telecommunication systems, all very rapidly rising and in some sense stressing the socioeconomic systems to keep pace with many of these trends. At the same time, these trends translate into impacts on the Earth system. The accumulation of carbon dioxide and other radiatively important gases in the atmosphere, the increase in surface temperatures that result because of these pollutants in the air. We are beginning now to overfish and see the collapse of marine fisheries as we try to bring protein into the human population in order to feed ourselves. We see enormous levels of nitrogen pollution, in particular affecting the coastal zones. We have biodiversity and tropical forest lost, on and on and on. And again, these things are in some sense accelerating, but they're happening much slower, but perceptibly, I would say, in contrast to these COVID and other pandemics. But this is the broader context in which the COVID is existing today. Now, the body politic in terms of the United Nations, let's say, has taken stock of these changes. And back in 2015, they organized the world community to ratify a set of sustainable development goals. These are very aspirational in nature. There are 17 such goals, and they're in the business of trying to bring about improvements in human well-being and the sustainability of the environment. And there's 17, as I mentioned, and they're dedicated to goals such as reducing the highest levels of poverty and inequity, eliminating hunger, bringing good health to human populations, gender equality, universal clean drinking water and sanitation, the design and building and management of sustainable cities and communities, preserving life in the oceans and in aquatic ecosystems, as well as preserving life on land, dedicating themselves to bringing peace, justice, and improved institutions that can really sustain humankind and the planet throughout the 21st century. One of the things to remember, though, in executing these goals is that they really depend on each other. And if one were to create that high aspiration of human well-being and environmental sustainability, and growing the economy in a sustainable way, these are the goals that would promote that. You cannot achieve anything like that without an equitable society. And you cannot achieve any of this without a well-functioning biosphere. And these things are all interleaved and interconnected. I'll talk about one issue that I know a little bit about. I come from the world of water resource assessment, and I know that there's an international audience here, so it might not be news to many in the audience that there is a so-called global water crisis, or a set of water crises that are occurring in many parts of the world. And there are all sorts of popular press coverages on these kinds of water issues. The World Economic Forum publishes every year a set of risks to the global economy. It's a set of reports that they publish. And in the 2019 report, it's interesting to note that water and water crises ranked number 4 in terms of its impact severity when pitted against 29 other agents of stress. And water crises were exceeded in their ranking of potential problems for the global economy, exceeded only by extreme weather events, climate change, and weapons of mass destruction. Interestingly, the spread of pandemics was ranked number 10 in potential impact, below these environmental crises. Now, the good news is that given the fact that there are these water struggles, it's actually very heartening to lay out this statistic here, that 90% of the world's population has access to a basic clean drinking water supply. Now that's the good news. The flip side, of course, is that 10% of the world's population does not have access to that water supply, a basic need for day-to-day living, and as a matter of fact, a basic human right according to a declaration made 10 years ago by the United Nations. And these struggles are encapsulated by what's happening in the city of Mumbai, India, okay? What I'm showing here is a plot showing a horizontal axis, which is the cost of water per 1,000 liters of water used. And on the vertical axis, I'm showing here the water quantity in liters per capita per day. This is the water use. Now, superimposed upon this diagram are these two words, richer and poorer. And if you look at the way that rich populations in the city of Mumbai are living, they typically would have piped water supplies. And because of that, they use higher quantities of water, prodigious amounts of water, but they pay very little for that amount of water that they use. In contrast, poor populations are served by commercial interests in many cases, where tanker trucks go into these poor neighborhoods and they sell water from the tanker trucks, and they can garner whatever the market will bear in terms of price, often 10, if not 50 times higher than what rich people are paying. So this is an encapsulation of at least one of the iniquities that the poor have to suffer with respect to getting a very, very basic survival resource. Now, this is not the domain simply of the developing world, and it is quite surprising to realize that there are water crises in the United States as well, and there's no shortage of headlines covering this kind of phenomenon. And the statistics are absolutely stunning for a developed world country. And let me just read a couple of them to you. So 40% of people who live in cities are documented to be living in neighborhoods with unaffordable water bills. And as a consequence of that, in a survey of some urban centers made in the last couple of years, 1 in 20 households will have their water supply shut off each year, those people living in cities. So there's a 5% chance if you live in a city, and you live in particular these stressed neighborhoods, you have a 5% chance that your water supply is going to be shut off any particular year. Furthermore, about a third of our population, more than 100 million, is exposed to toxins in their drinking water supply. And this is particularly important in terms of urban water supply. And this exposure is actually one of many types of exposures that we as humans are living through, as it were, as we go about our day-to-day business of living. And there's this gentleman here who is my friend that I use to explain what an exposome is. An exposome is quite literally like our genome. A genomic or genetic constitution gives us our own individual fingerprint, but we also have a fingerprint in terms of the exposure that we have to environmental stimuli of a variety of types, potential toxins like in drinking water, like in the atmosphere, like in the foods that we consume. And every particular person has a unique fingerprint of exposure to the environment. Okay, if I grew up in the city, which I did, I have a very different exposure to all of this than does someone who grew up on a farm in the Midwestern United States. Now, to study this, we will need a combination of environmental and epidemiological surveillance systems. We'll have to have in place the right chemical quantitation. We'll have to understand the biology of these systems. We'll have to bring in medical sciences. We'll have to bring in geographic information systems and system dynamic models, big data analysis. And in some sense, this is a contact tracing for environmental exposures generally, not just COVID. And you know that term contact tracing was popularized in terms of COVID, but it's also, I think, quite relevant in terms of exposure to the environment and environmental problems generally. And this set of vignettes is to remind us that we have an arsenal of tools that we can really lay onto this challenge. We can use satellite remote sensing, for example, to detect outbreaks of urban heat island effects that would have enormous human health impacts localized over cities. We're developing within our institute microsensors that could either be wearable and in concept could be embedded within humans, so that we have a near real-time individualized set of exposure functions that we can monitor minute to minute to minute. Now, there, of course, are civil libertarian issues involved in all of this. But if we are able to have an appropriate dialogue about this, we could arm ourselves with an arsenal of these sensors that would allow us to understand what environmental burdens look like today and into the 21st century for people living not only in cities, but universally in rural areas as well. That should give you a hint that these problems are multi-headed dragons, and we really have to understand them in their full complexity. I'm showing a diagram on the left here to remind myself of my own career, and I date back, I was minted with a PhD in the early 1990s. That in the time since I've received my PhD, where I really focused on the physical aspects of water, working with colleagues on water crisis issues, it dawned on us quite early in that dialogue that you have to also be talking about biology and chemistry, and you also have to be talking about how humans manage water. So in the last 15 to 20 years, let's say, we've moved from a single disciplinary focus, quite stovepipe, let's say, to something much more holistic. And I love showing this little image here, and this is encapsulating a thrust coming particularly from the engineering, planning, and environmental management community to really think that, you know, we have these tools like the Swiss Army knife of the late 20th century, but for 21st century thinking, planning, and environmental management, we really have to take that Swiss Army knife and we have to make something quite a bit more complicated and function, but yet at the same time functional out of it. And coming out of this community, particularly the engineering community, they're very keen on serving the needs of these sustainable development goals and creating engineering for sustainability. And this involves creating a new workforce. And it involves taking stock of the way we educate our engineers, environmental planners, and managers. And some have gone so far as to actually advocate for a reworking of our curricula. And a colleague of mine, Bill Kelly from the American Society of Civil Engineers, is actually advocating for embedding general education back into the civil engineering curriculum, so that when engineers design a particular facility, they understand the legal context, the social context, the cultural context, and economic context of their the designs and construction of these facilities. With that, I will turn the podium, the electronic podium, over to Nina, unless Phil would like a little introduction. Thank you.
No, not at all. Without further ado, I will just pass over to Nina, and then what we'll do after that is we'll have time for a few questions. We're doing okay time-wise, so we'll after Nina's presentation we can move on to one or two questions for the panel.
Great, thanks so much, Phil, for having us as part of this webinar series. It's really been fantastic to participate. And thank you, Louisa and Charlie, for your excellent talks and for queuing up, I think, already the importance of higher education in solving some of the issues that we face with the multiple crises that are going on. I think it's clear from Louisa and Charlie's talks also that the crisis that we're facing with COVID-19 is worse because we failed to address the underlying crisis of inequities in our society. And that's going to continue to be the case if we continue to ignore the structural problems. Louisa talked about public health, Charlie talked about the environment, and I'm going to talk about a third issue, which is in higher education, with the hope that creating more equity in education will lead us to more equity throughout our society. So as an interdisciplinary scientific research center in a large, successful public university, we obviously are focusing on STEM research and education as the place where we can have an impact. If you're a hammer, you think everything is a nail, right? But actually, we really want to focus on STEM education for much larger reasons, which Charlie and Louisa already alluded to. The most challenging problems facing the world, much like the environmental problems that Charlie mentioned, health problems, the energy sector, which was part of a previous webinar in the series, information technology, all of these issues that we need to tackle really require advanced scientific knowledge. They require interdisciplinary scientific knowledge. And they require us to focus on developing a large and diverse STEM workforce. And a lot of agencies in this country have pointed to the fact that the lack of underrepresented people of color in STEM is going to be a long-term problem for science's sustainability and for this country to remain competitive in STEM. I'd also argue that in this country right now, we also need to be training more people in the kind of critical thinking skills that science teaching imparts. So that's another benefit. But the other side to this is that STEM is a job sector that is increasing, and that growth is predicted to continue for a long time. STEM jobs also pay very well. And so the issue that Louisa brought up of the income gap and the wealth gap for minority populations can also be addressed by helping students of color stay in STEM, well, first be attracted to STEM, stay in STEM, and be placed in the workforce. And that by having these positions with higher income, they're able to advance themselves and their families and communities. So, this is one other way to think about the benefits of a more equitable pathway to STEM careers. As things stand right now, the picture is not great. A third of the US population are people of color, but less than a quarter of bachelor's degrees in STEM go to people of color and less than a tenth of doctorate degrees. Also, when underrepresented minorities leave this academic STEM pathway, they're also less likely to stay in STEM careers. So as we are reopening the ASRC following the COVID pandemic and rethinking what we can do in this post-pandemic future, hopefully soon post-pandemic future, it's really the perfect time to reflect on how we can do more and do better and take aggressive steps to change our approach to STEM education to make it more equitable and inclusive. What is it that we can do to improve retention of students in STEM degree programs? What can we do to buffer students during these sensitive transitions between degree programs? What can we do to keep them in the STEM academic pipeline or in the STEM workforce? And this is not easy. It's not going to be an easy problem to solve. And it's also difficult to start addressing this at the university level, which I have to acknowledge. The New York City public school system, this is data from them, serves over 1 million students in their K through 12 public and charter schools. About 70% of these students are from racial and ethnic minorities. About 80% are from disadvantaged socioeconomic backgrounds. And there are problems in science proficiency as students progress through this system. So here I'm showing proficiency of students as tested during grade 4 in blue. And at that time, racial and ethnic minorities are actually performing pretty close to the majority students. But by grade 8, their performance drops far more than the performance of the majority students, which suggests that they're going to be arriving at college less prepared for those STEM majors. COVID is making this problem worse. Students who are, this is showing data from students who are in high school now, who are in the bottom quartile of the socioeconomic ladder and in the top quartile of the socioeconomic ladder. And students at the top, 80% of them have access to daily distance learning activities during this pandemic. But in the bottom quartile, less than 45% do. 25% have no access at all to distance learning activities. So we're going to be seeing an increased disparity in those students that are coming into college going, after this pandemic. And not surprisingly, the pandemic is leading students to reconsider what their plans are for higher education this fall. About 20% of students are estimated to have changed or canceled their plans for the fall semester. And this is worse in Latinx and Black populations. Many of these students have decided either not to go to college this year or to go to a community college instead of a four-year college, go to school closer to home. And similar data exists also for current students who are enrolled and deciding whether or not to come back in the fall or to delay completing college. So this makes it even more urgent right now to focus on what we're doing for the underrepresented students who do plan to go to college so that we can retain those few students who continue their education and want to succeed. And I would argue that CUNY is the premier place to do this because it's already been proven as a successful engine of socioeconomic mobility. And multiple studies have actually shown this, and I'm showing one, which looked at over 1,500 US colleges in terms of their results in moving students who grew up in the lowest quartile of the socioeconomic ladder and through their education moved up to the top quartile, which Ryan had talked about in his introduction. So a measure of this is plotted on the y-axis here. So the higher up you are, the better you are at moving students up to that top quartile. The dark blue dots are private four-year schools, the light blue dots are public four-year schools, the orange dots are two-year community colleges, and the red dots are for-profit schools, which I'll point out are the worst at moving students up. So in this analysis, 8 of the top 15 four-year colleges, private and public, are CUNY schools. So this is really a tremendous effort. Number 2 here is Baruch. Number 3 here is the City College of New York. And even if you look at the two-year colleges, which because they're only two-year programs are a little less effective, but nonetheless are very important and can transition students to those four-year schools, 6 of the top 10 are community colleges within the CUNY system. So since almost half of CUNY students come from households that are earning less than $20,000 and greater than 80% of them remain in New York for their careers once they graduate, this is a huge impact to New York State and to New York City in terms of its economy, but also its community. And I'll go back to the maps that Louisa showed, showing the distribution again of where those CUNY schools are. Many of them are located near or in dense populations of Black communities or Hispanic communities. And the CUNY system does have more than 50% of its students from minority populations. But I would point out even those schools that are in predominantly white neighborhoods. I'm taking an example here of Hunter College, which is right in the middle of Midtown Manhattan. That neighborhood is predominantly white, but the students that come to Hunter are actually coming from other neighborhoods. They are more likely to be Hispanic, more likely to be Black than the surrounding neighborhood. So CUNY already has a number of programs that provide various kinds of support for students from diverse backgrounds, as well as students who may be first in their family to go to college or who are facing a variety of financial hardships. I've listed just a handful here. some of which are nationally acclaimed, like the CUNY Accelerated Study and Associate Programs. And these are all very effective at helping to support these students so that they complete their degrees at CUNY. I'm going to focus on two of these programs, which are here at the bottom, because they focus on STEM research. And their outcomes are wonderful. So, for instance, the CRISP program, which facilitates community college students transitioning to senior colleges, shows that those students who were in the program are much more likely than their peers to move on to a four-year college that is research intensive. Students in the PRISM program are much more likely to have developed an interest in graduate school and wanting to go into STEM graduate programs. These programs also have a much broader impact. They help students in their performance across all of their courses. They help students in terms of self-confidence and self-identification with the STEM community, and these in turn are what helps and drives their retention within programs and advancement. I'll point out that it isn't just CUNY that are running these programs. Obviously, there are programs throughout the country. Many of them are supported by the NSF or other federal or nonprofit organizations. So when we look at these programs, what is it about them that makes them impactful and successful in advancing these students? So a few things that I noticed when I was looking at this is that although they do help to address the proficiency gaps, which I pointed out at the beginning of the presentation are clearly there, they're not remedial in nature. They're actually excellence programs. They're also long-term and in-depth, and not just summer research programs, but they last a year or more. And this really allows the students to integrate into the lab and the science community, to really get to know their mentors so that they can have long-term relationships with them, to really develop peer networks that are supportive socially as well as professionally, and that can last for a long time. And it benefits their professional development, it provides career guidance, and it also provides financial support. So in looking at this, what it reminded me of in particular is kind of the holistic approach that wellness programs try to address. They aren't just academic programs, they're holistic and they pay attention to the needs of the entire student. Recognizing that if there are problems outside of the academic life, in the family, financially, mental health, that there are also going to be problems in terms of academic attainment. And it isn't just me coming to this conclusion. Actually, these are published results. The Association of Public and Land Grant Institutions, for instance, published a report this year coming up with similar conclusions. NSF has as well. But one of the other things that they found is that there are very few programs like this. There are quite a few, but there are clearly not enough to address the large problem that we face in the STEM pipeline. Some other things to point out that lead to success in STEM programs for all students, but in particular for students who come from disadvantaged backgrounds or maybe are first to college in their family, is the programs need to be built with input from the students themselves. It needs to be approached with an honest assessment of what the strengths and weaknesses are. The leadership needs to be visibly in support, and ideally the program is incorporated as part of the core mission. Faculty need to buy in, and the time spent on these programs needs to be recognized as contributing to teaching and education, maybe freeing them up from other obligations that they may have. There needs to be transparency, reporting, reassessment, and importantly, funding. For us, we rely a lot on city and state funding, but also federal funding from the government. The nonprofit world is also heavily engaged in funding programs like this. I would argue we need more participation from industry and more participation from philanthropy, particularly for public universities. So there are two perspectives here. From national perspective, how do we get more of these programs? And there are other places that are tackling that problem. The CUNY ASAP program that I mentioned before is being replicated in other places. The Howard Hughes Medical Institute is also working to replicate the Meyerhoff Scholars Program that's at the University of Baltimore County. But we at the ASRC are looking at this locally. What can we do locally to maybe strengthen the programs that exist at CUNY, and maybe create some STEM program for minorities that's on steroids? So what can we do there? What is our strength that we can bring to the equation? And so I bring two other points that can lead to success that I think the ASRC is well poised to contribute. And that is by helping create partnerships that cross boundaries, both in terms of discipline, but also in terms of programs, campuses, and even universities. And we can also provide a direct link to future job opportunities through partnerships that we have with industry, many of whom come to the ASRC to use our core facilities or collaborate with our researchers. And so from this, we developed kind of a model of what our vision of programs that the ASRC is creating look like. And that is building on the excellence that CUNY already has in programs like this, adding in the world-class facilities that the ASRC has and the world-class scientists that the ASRC has to build those programs even larger and stronger, connecting those with our industry partners and our academic partners, not unlike our partnership with Strathclyde, which is really beneficial for us as well. And then infusing money, so helping to support the generation of grants and funding for these programs to develop fellowships and internships that talented, diverse students can take advantage of. And within this holistic bubble, train the students and then aggressively help place them in either academic positions or within the STEM workforce. But really importantly, continue to have them as part of our community, continue the mentorship and networking, bring them back to help mentor future students and incorporate their feedback as we continue to improve the program. I think it's really important to point out that this would be something where we would participate with the CUNY schools and sort of continue the mentorship as students progress from community college to senior college to PhD program, and that may lead to kind of a different approach to mentoring students. Instead of encouraging them to leave the university that they started in, maybe it's better for them sometimes to stay so that they can continue to have their mentors close by so that they can continue to be part of the same program. One program that we've already run that's similar to that sort of has these features was led by Charlie, actually, in our environmental sciences initiative, and called Transformational Experiential Learning for Leadership in STEM. And it used environmental science as a domain to prepare STEM students with data science skills in particular that are needed for the 21st century smart city workforce that Charlie was referring to earlier. That was through a partnership with IBM and the Business Higher Education Forum. So again, bringing in our industry and nonprofit partners. And it brought students from CUNY community colleges to the ASRC for an intensive research experience and mentorship. Our first cohort from that program graduated last year, and already we've seen students from that program go on to receive fellowships from the National Science Foundation and the National Oceanic and Atmospheric Administration. We're also starting programs through our Center for Advanced Technologies grant from the Empire State Development Fund called the Sensor Cat, which is led by Ryan. And it's focused on developing high-end next generation sensor technology in both the biomedical sector and the environmental sensor market. And it builds off all 5 of the ASRC's research initiatives: nanoscience, photonics, structural biology, neuroscience, and environmental science, as well as building off those advanced core facilities that we have in our center. The CAT is designed to create academic industry partnerships for applied research, for research development, technology transfer, and workforce development. And we've most recently been working with small companies in the New York City area who are pivoting their work and research development to address COVID and the post-COVID world. In terms of workforce development, the CAT supports professional certificate programs and internships, and importantly encourages and teaches students about entrepreneurship so that they can see themselves moving into the startup world. And this program is really a model for partnering STEM education within the university system directly with the the future employers of these students, so that the students can begin to understand what that workforce is like, what the environment is like in that workforce, and what employers are looking for, so that they're prepared after graduation. We're also working to expand the concepts from Charlie's program and from other programs that we've run with community college to really have a broad approach and bring community college students to the ASRC from throughout CUNY into a really massively holistic integrated program that starts from the ground up and really builds from the idea. This actually reminds me of, if you're a psychologist, of Maslow's pyramid, where you really start with safety. Somebody needs the financial support. They need to know that they have a community and a peer network that they can feel safe with before you can start to really teach them and educate them on professional skills, like those critical thinking skills I was mentioning, providing them with mentorship, and then STEM skills and interdisciplinary knowledge that's going to be necessary for solving the future problems of the world. It also will teach them how to collaborate, how to build networks, and importantly, find for them the academic and industry partners that they'll need for their future careers. So to sum up, I just wanted to say, I think the best programs for supporting the retention of students of color and lifting students out of lower socioeconomic conditions are those that are fully integrated. They incorporate strategic partnerships that cross traditional boundaries, and they invest in the whole student over a long period of time. They go beyond addressing STEM competence and welcome students fully into the scientific community from the outset. And by building scientists of color through these programs, all of our communities will benefit by having a larger number of interdisciplinary scientists to address those large-scale problems that Charlie was talking about, that Louisa was talking about, and that many other people during the whole series have been discussing. And in particular, their insights can be brought to bear on addressing directly the inequities that exist within our societies. My final thought is these programs are expensive in terms of time and money, but it's high time that we make that investment, and that those investments come from all possible sources, from government to industry to philanthropy. And that's how we'll be able to scale them up and expand their availability to all the students who need them. My last pitch, since public universities present the most affordable and efficient option for students and their families, and CUNY has shown that public universities can be the most effective at generating this kind of change, they should be the focus, I believe, of future funding and development. Thank you very much.
Brilliant. Thanks so much for that presentation. I think that at Strathclyde, we see ourselves as socially inclusive, progressive university. So everything you said there kind of absolutely chimes with and is aligned to our value set that we have. And I think that I'm pretty sure, hopefully, it aligns with kind of pretty much everybody else that's on the webinar today. I've got a number of questions. I'm very conscious that time is moving on, though. So what I'd like to do is, can I just kind of wrap up a question that will take in so many different messages that I've had through, and it's really around the SDGs. Charlie talked about the SDGs and the kind of importance of them, and I think kind of the conversations that Louisa and that Nina you've had, I think, speak to me as well around, we talk about SDG number 1, about no poverty, about 3, around health. Charlie, you talked very specifically about the issue around water, which SDG 6. And I think an awful lot of the conversations also incorporate SDG 8, where we're talking about decent work and economic growth. And I just wondered that the overarching SDG for me is always SDG 17, partnerships for the goals. Is there a risk that we end up talking to each other as a group of people who clearly buy into the fact that this is massively important, that sustainable, inclusive growth has to be the way out of the COVID crisis? Is there a risk that we end up talking to each other and not externally? And so what other stakeholders would you like to see brought into these conversations to ensure that the partnerships for the goals that are going to meet all of the challenges that all three of our presentations today have talked about? How are we going to manage that process, and who should we speak to on it? Can I start with Lisa, since you were our first speaker today, and get your thoughts on that?
Sure. From our point of view, our stakeholder will be the local health department, the health and hospital corporations, as well as other non-profit organizations in the city that sort of work very closely with our institution and our students.
Great, thanks. And Charlie, did you have any kind of thoughts, particularly, I guess, around water? I mean, we've seen really significant issues across the globe in terms of water shortages, and you're preaching to the converted, I know, but you know, we accept that water is a human right. How do we then ensure that getting water to, and massively importantly, getting water away from people who are often socially excluded and living in poverty, where that absolutely requires partnerships for the goals to make that work? Who should we be pressurizing for that?
Right. So there's certainly water is a right, a fundamental human right. I would also say, in the context of the goals and more broadly, the alleviation of poverty is an expectation and, in fact, a right. People should not be living their lives in destitution. Okay. Now, what I find very interesting is that there's a very vibrant discussion going on within the SDG community, and in particular the academics and the practitioners getting together to try to understand orthogonalities within the SDG context. And so, although one might wish to alleviate poverty, history has shown us that as societies have developed, they have very strongly debilitated the environment, okay? And in particular, have made it more difficult to produce sound, clean, reliable water supplies. So understanding these orthogonalities, right, as you economically develop, that's a great thing. But if you do it at the cost of the environment and at the cost of clean drinking water, you have a handicap to try to overcome. I would say very broadly, the public sector has failed to do its job with respect to water security. Therefore, one must look to partnerships. We need to look at civil society. We need to look at the public to create an impetus for remedying this situation. And we also have to very critically, and Nina talked about this, we have to engage the private sector. And as I understand it from the people I know in this world, there is a sustainable investment community that is attempting to mobilize literally trillions of dollars that could be put into sustainability-based investments that do not destroy the environment, that assure social equity, and at the same time create the right kinds of institutions for public-private partnerships to protect the environment and, in essence, protect that economic imperative at the same time. So we could have both if we have this inclusive dialogue.
Brilliant, thanks, Charlie. And Nina, just kind of moving on to the presentation that you were doing, where again, there are so many different aspects of the goals that yours cuts across. I think decent work and economic growth, clearly one of them, but I think it's far broader than that. But I guess the bit that strikes me from your presentation, and again, you know, we both work in socially progressive inclusive institutions where both institutions are very much focused on useful learning and applied learning. But why isn't everybody operating programs and schemes like you have, and we have similar ones, but we all know that not everybody's doing it. We've just finished a project with Dell called STEM Aspire, where it was a kind of very similar one, and it was a good example of a partnership. But why isn't everybody involved in it? Why doesn't all institutions and all organisations understand that this is a fundamental responsibility that we all have?
That's a great question. I'm probably not gonna be able to answer it, but I did mention it was expensive, and I do think that's one reason. I also see, I mean, from my own experience in the academic culture, a few different aspects of academia that discourage this kind of behavior. So one thing I was hoping to talk about, but clearly didn't have time to talk about, are these factors. I think that academia focuses on prestige and metrics of prestige. And to some extent, we need to reevaluate how we evaluate people and what we value in those people. So if we continue to use metrics like GRE scores and SAT scores in order to admit students, we're only going to admit students that do well on those tests. And those tests are not predictive of doing well later on. And that's just one example of how I think we need to examine the criteria we use to promote people and select people for success within the university system, and then figure out how to communicate that out to employers as well. So that's one area. I think, you know, the other thing about, I just said employers, the other thing about the academic culture is that it tends to want to produce more academics. And that's a natural tendency. I'm sure Ryan and Charlie would love to produce more professors within their field. It's nice to see people follow in your own footsteps. But the reality of the situation is there's so few of those positions now that universities do need to shift to, like you said, a more applied approach. What is going to be more practical, what can actually put people into jobs rather than try to retain them in an academic track that barely exists anymore. So those are a couple thoughts that I had on those lines.
Great, thanks a lot, Nina. I mean, I guess the big concern is that until we do tackle these kind of really key and significant challenges, then we stand accused probably of systemic inequality. That, you know, if we're not doing more to try and resolve it, then actually we are guilty of being part of a system that is encouraging inequality. So I think it's a real kind of thought-provoking idea that we all have to take on board. I am conscious of the time and we have gone over, but that was because the presentations were so insightful today. And I think that I was really keen for us to get some of the presenters' thoughts. So what I'm going to do now is I'm going to hand over to Ryan just to wrap up today's session. But before I do, can I first of all say a massive thank you to our presenters, to Louisa, to Charlie and to Nina for, I think, one of the most challenging and thought-provoking sessions that we've had in the series. It's been a real eye-opener and it's given us all some real thought for food for thought. Next week is our final session and we will be travelling from New York to Milan for the final session for Politecnico di Milano, who will be talking to us about the future of work and what their thoughts are on what post-COVID the work environment might look like. So a huge thanks to everybody for joining in today, particularly to CUNY for, as I say, for one of the most insightful presentations and thought-provoking that we've had in the series. And can I just hand over to Ryan to finish off and to say goodbye on behalf of CUNY.
Thank you, Phil, and thank you everybody for dialing in today. It was, I mean, it's been a really, as I said at the beginning, this has been a real, a nice constant throughout this really crazy period. For 2 months, we've had, like, every Tuesday, morning for us. We've had these incredibly interesting discussions, and we've been really delighted to be part of this. And it's actually been incredibly helpful for us also to get our conversations going internally. You know, there's nothing like planning an event and then comparing notes and thinking about what we should really be doing. So it's been incredibly useful in that way. And also, I think, again, it highlights the similarities with with Strathclyde, a place that I care about a great deal, and I hope that we can really continue, comparing thoughts and also exchanging people. And I'd love to come back to Glasgow when we're allowed to do this again, and vice versa. We'd welcome anyone on the call, from anywhere who's interested in continuing this conversation. Please reach out to us. We're serious about this. We're going to be doing this, and we'd love to compare thoughts with like-minded people across the globe. So with that, I mean, I'm incredibly grateful to my colleagues. They've done an amazing job, and also really grateful to Strathclyde for including us in this very nice opportunity. Andrew, nice to see you again, not in person this time. Phil, Marie, Marina, everybody, thank you so much, and we'll hopefully see you all next week for the final one. So thank you very much.
Great, thanks everybody. Enjoy the rest of your day. Bye.